throughout this pandemic for Black people, poor people. When you're sick already, then it doesn't take much to push you over the edge. So, really making sure that we're paying attention to that and making sure that we are preparing for the next pandemic by preparing physically. I guess I didn't understand that perspective from the political perspective, that you had to put a period on it to do like a look back. I forget what they used to call it during my brief career in corporate America, where you have to see what went right with a project, what went wrong, and how to learn from that, so that you can move forward better the next time. I mean, the information, the quality of the information was so poor that it really left people to just come up with what they thought was best, which I did myself. At a certain point, I stopped listening to CDC because I felt like it was bad information, so I wasn't going to listen to it. So I guess that's enough of my perspective. I think throughout the pandemic, I didn't see people recatching it until this January. And it was, when people did recatch it tended to be pretty mild. I didn't have anyone who really required any type of intervention when they caught it the second time, which is another thing I think is important, that as people catch the illness from that study that we saw out of the data from California and New York, once you have actually experienced the illness, hopefully you don't die. If you don't die, then you're in better shape than most people on the other end of it, but then not everybody makes it, so yeah.
So I think from my perspective, you have to kind of tease out the medical and also the political. And within the medical, what I think we don't really talk about, I think it's more coming to the forefront, is the emotional toll that it took on people. You had so many people isolated, scared to come out of their house, isolated from friends and family. Although the kids have suffered, they lost like 2 years of that socialization, and that has been a really big issue. Right? I see a lot. I'm an oncologist, so I see a lot of obviously cancer patients. In my patients are generally immunosuppressed. So we really did a really aggressive, if you have a fever or cough, you cannot come in because, Lord forbid, if you bring COVID into the unit, somebody's going to catch it and they're going to have a bad outcome. From the political and social standpoint, I really think it really kind of tore the scab off of our culture. How people are selfish, and we all talk about community, but really think people that feel they want to do for themselves and not really care about anybody else. So I really feel as though, rich people got richer, poor people, on the front lines. You guys remember in that March, April of 2020, there was nobody on the roads. We're standing outside the supermarkets, the cashiers and everybody in there all day, no masks. Those were the heroes. We got a lot of things, healthcare heroes, but really the people who are really the heroes are the people making sure we're fed, the police officers, the people in the hospitals cleaning the rooms for people who had COVID. So those were the heroes. Those were the ones who kept society going. And I think what's lost is a lot of people feel as though it's all about me. I don't care about anybody else. And I think that's why this is kind of perpetuating. It's still now in our system, in our society, and it's not going to go away, unfortunately, because of this mindset.
Sure. So preparing for the next wave is going to it's going to challenge all of us to understand, I'll call it our role. And our role in preparing for that next something really, to me, has to do with how are we listening to and thinking about leaders in our community. There's mention that we didn't really hear too much about monoclonal antibodies, and we kind of did hear one person talking about it, and it was Donald Trump, and he was saying, it's a good thing, and we would all kind of look at him and come on, dude. And it wasn't that he was wrong. Now, he grasped at like 15 other straws, none of which would be, medically recommended at all. But we got to figure out how in the world we pull health care away from politics, right? So we talk an awful lot about separation of church and state, and yeah, but we got to figure out how in the world to separate kind of medicine from politics. Otherwise, we're not ever going to follow medicine really as a united front anymore. And when medicine becomes the united, weapon, if you will, when viruses continue to really plague our communities, we need to be on the same page. And politically, we're generally not that. And we didn't use COVID as the opportunity to get on that same page and fight a common enemy. We decided to use it as the dividing factor. And that's really going to continue to play out for the next, I don't know how many years. But realistically, it's on us to fix that. And I don't mean us as in us, the elected officials. I mean us as a community to make sure that we continue to rise above that, both listen to all sides, listen to our doctors. I say over and over and over again, like, if you have a doctor, see a doctor. If you don't have a doctor, get a doctor and then see a doctor. Don't ask politicians, and people did, what to do. Don't ask me what to do about COVID. Ask your doctor. Don't call the state rep, and folks are following the news. Don't follow. And it got to this really nasty point, unfortunately, where then the medical recommendations began to be what's politically feasible. And that's where everything really spiraled. When the medical recommendations around how we open schools became, okay, well, how can we open schools, and then we'll figure out what we recommend medically. And again, all trust was lost.
I think that's a really salient point. I will say, from the perspective of being a breast cancer surgeon and looking at what happened to breast cancer screening, right? During COVID, screening dropped 90% at a time when Black women are facing breast cancer mortality at an astronomical rate. We told people, don't come in, don't get your screening. But what I found was that there was a lack of health literacy. People didn't understand screening versus, say, diagnostic. You have a problem, you feel a lump, you have nipple discharge, you didn't come in. And now what we're seeing on the back end is I'm seeing patients with a lot of advanced disease because they waited, because they were told, don't go to your doctors. And so I think there's two real issues here. One, with where we're getting good advice, but two, also health literacy. And so my question for all of you has to do with, I think, how and who should be informing the community, and how do people who don't have medical background, how do they dissect some of this information? Who do they know what to believe? And then, Representative, for you, how is it that judges and lawyers can make decisions that impact medical care that maybe isn't as informed by the physicians that you're referencing? What could and should be done? What type of collaboration can be done on the ground level to begin to influence some of that? Because people will listen to the judge that says we no longer need to wear masks, when a panel of physicians are saying we need to continue to be vigilant and wear masks in certain settings. So the question for the panel is about, who do people believe? How do they find and source good information? And the question for our representative is, how do we collaborate differently with legislation, with politicians, with our community leaders to get that good information out?
Well, I got the microphone now. Good luck getting it away from me. You ain't gonna win that one, I'm sorry. So, I'm so glad you asked the question about health literacy. I spent 25 years of my life on this issue, particularly in the African American female community. It is well known that Latina and African American women, from a heart perspective, for cardiovascular disease, are the least educated, yet they have the most disease. So there's a disproportion between their level of understanding, their risk factors, the availability of preventive strategies, and their level of, obviously, health literacy and their disease. So one of the things that needs to happen are things like this. People have to start to take some responsibility to look for credible information. So where do you get it from? It starts with opening a dialogue with your physician. That's the first part. It starts with having and holding our organizations like the CDC, like the NIH, where there's credibility, or should be credibility, holding them to the fire. Now, that being said, one of my colleagues here mentioned that she stopped believing the CDC. And the CDC was being, in my opinion, bullied. I just put it out there, bullied. They were being told to tell people things that were a little bit more in line with what was happening politically and socially, and that messed the message up. What should have happened, in my opinion, which I was at home screaming at the TV, was that they should have come to local physicians that were important messengers and trusted officials to get the word out to the African American community. It was supposed to happen, but I don't think that it happened in the way that was the most efficacious or the most beneficial. There were a lot of our organizations that were slow to the take, and we need to hold some of those medical organizations to the fire, because we are the credible ones. You come to us, we don't know you, we don't know your name, we don't know if you're a good person, we don't know if you're a bad person, we don't know if you cheat on your wife, whatever. But you come to our office and you ask for our help, and we give it to you. So if you're coming to a physician on a regular basis, there's trust there, and there should be. And we should have been much more involved. The American Medical Association should have, in my opinion, done much more grassroots with local physicians. ABC should have done much more grassroots with local physicians, so that the people whom we care for were getting the message from the most trusted people.
So there are a couple things. One, lawmakers get to unfortunately play in this space because these individuals are expensive, and there's this whole huge insurance industry, and therefore with a huge insurance industry there's the opportunity to try and regulate things, which gives us a microphone and some say. Two, what's very important with pandemics, with mass medical concerns in the community is what is the role of protecting the community to the extent that you're then infringing on individuals' decisions. And we all think of this notion of like, well, we need to make sure we protect each other. That's an imperative, and it is. But we also have to remember that there's kind of this underlying kind of strain of belief that has just been, it's just classic American, if everywhere, which is this notion of kind of the rugged individual. Rugged individualism is real. It's alive, it's real, and it effectively is what allows some people to say, well, I'm young, I'm healthy, I don't need health insurance, I'll be okay. The virus, it sounds like it's kind of like the flu, I'll be okay. I'm in rural America or rural Pennsylvania, and folks don't come to rural Pennsylvania from China all that often, we'll be okay. And people get to make their own personal decisions. And when the government then says, well, no, you don't, here's what we're now going to impose, it's a good thing that there are checks and balances to kind of stop that from happening. In this case, it's one of those things that hopefully is for the betterment of the community, and we don't necessarily see racist intent in it, but I promise you, if there were additional racist intent that we noticed, we would, as a community, our hands would be in the air saying, whoa, 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 whoa. This seems like significant overreach. And fortunately, it didn't really get to that point. The one area that was going to be really drastically, like a flashpoint issue for the African American community, we didn't get to talk about it too much. It didn't really come to fruition, were kind of vaccine mandates and tying an awful lot of employment to vaccine mandates because, get in trouble. We as the African American community still, we still sit back and we think about how medical history has not been kind to the African American experience. And our fingerprints in that has not been one that we all want to celebrate. And so, we tried this notion that African American community we were not hesitant, we just didn't have access to the vaccine, and that's not true. We were hesitant. And we were getting ready to have an awful lot of black and brown folk who've got reasons that we all talk about. Where do you get your medical advice from? Many of us get our medical advice from mama and from Big Mama and from the family text chain and this, that, and the other. That's where we're getting our medical advice from. That's where those legacies still exist. And it was getting ready to cost an awful lot of us our jobs. And we were getting ready to have major issues. Didn't happen, fortunate. That's not right now our major narrative, but those are the reasons why we as elected officials get to play, because we help figure out how in the world we're paying for these folks, because there is civil liberties involved. And the one area that I do also want to chime in is the folks we are listening to is us. So when I say we need to play a major role in protecting this from going forward, that's us again.
I know. I would like to touch on this a certain point, because I have one hat as the president of the Medical Society of Eastern Pennsylvania, taking that off right now. I'm also a registered member, lifelong member. Parents were members of the Nation of Islam. We've never been into vaccines like that. And so I think that there has to also be room for diversity of thought, beliefs, and even if I think that I ran into a little bit of an issue, because then even as the data changed, the policies didn't change. So as the data became clear, that as we just got finished shaking our heads to, if you have experienced the illness, we've seen, I think all of us have seen the charts. It's pretty consistent. If you've had the illness, you're very unlikely to get seriously ill again, maybe more protected than someone who only had the vaccine, and yet you still might have lost your job if you didn't comply with that. And it's probably still true now. That, I think it actually still is a problem.
It is.
And these are things that people are feeling and thinking, and I think that it was very dismissive, I think, to put everyone's rejection of the standard recommendation into a pile of ignorance. Like, you only think that because you're ignorant, because it's not true. It's really disrespectful of the ongoing history of abuse, where I think that really, if you're looking at a situation where even like manufacturers of medications, they have their agenda, right? You have to have somebody that's gonna be pounding on their door, making them do, like, if nobody is doing it, then they're not gonna care. They're not gonna do it because no one's questioning. So I think there always has to be like a yang to the yin, and that is something that I think is still not quite resolved. But I think when you're too far this way or that, then you're going to lose a lot of people. And I think that that's one of the things as the medical society I think is important. We're part of the community. Like, these are our families, and I think that I don't think we should so easily just throw people away. Like, well, you're stupid, get out of my life. Well, I don't think we can do that, especially when, even on the scientific side, the information isn't quite what we all thought that it was when it first started. We thought that you couldn't spread the illness if you got vaccinated, which turns out to just not be true. Or that, there are a lot of things we thought that it turns out it's not true. So now what do we do with that new information? So, I don't know.
I love the diversity of thought on the panel, and the fact that we can sit here and we can still have the best interests of the community at heart and talk about the different ways to do that. And the next, and I'm going to call it probably our final question as we begin to wrap up this panel, is to remind folks that life hasn't stopped just because of COVID, right? Heart disease has not gone away. Cancer has not gone away. Diabetes has not gone away. Poverty has not gone away. And the question for all of you is, what would you like for people to do, to focus on, to take away from the lessons that you have learned from COVID to make their lives healthier and better? What are some of the key lessons and things to focus on moving forward as the focus shifts from COVID to now balancing COVID and our lives? What do you want folks to know?
Well, that's a hard one. I would like to see, I want to say one thing. First of all, the last pandemic in 1917 was handled very differently than the same stuff, crazy stuff happened. The president was involved in a war, World War I. He didn't care about the pandemic. So he actually got infected with the flu, which people think had a huge impact on the accords and the agreements they made during World War I. Number two, Philadelphia had a big parade, and they were told not to hold a parade because of the pandemic. They didn't listen. And if you go to the Mutter Museum, you can see the pictures of the number of people being carted out of their houses and taken to sanatoriums. The way they handled it then, and I'd love to hear what our elected official has to say about this, is at some point it got to a point where it didn't matter anymore. They said if you didn't wear a mask, you go to jail. That's how they handled it in 1917 at some point. And I just think it's an interesting contrast to how our society has really changed and our values have changed and things. It lasted 2 years. Because we didn't take harder decisions, we are 3 years into the pandemic. And we still haven't, and none of us can say it's over. So just some food for thought, just for food. I'm not saying they got it right, but they certainly handled it differently, and it certainly lasted less. As far as we're going into the future, I would like to see people have more respect for each other's health. I really do. And I would also point out that when these decisions are made, it's costing all of us. One of the things is the disparities in health that are present in our United States. Yes, it affects Latin people and people of color more often, but it really affects the entire society. It affects the GDP. It affects how much money. It affects our financial situation, because still in the United States, we're not allowed to tell people that if you come to the hospital and you have no money, then you need to leave the hospital. We take care of you. In Temple University, we take care of you. If you come and you have no money and you need bypass surgery, you get bypass surgery. If you need a stent and you're having a heart attack and you're uninsured, we take care of you. So unless we're going to change that, I think we all need to realize that we are all in this together, and we need to create systems that are beneficial for all of us. Everyone's lives matter. And in the United States, we're still practicing medicine that way, which is a good thing.
We're talking about the future, right?
What do you want people to take away from here that will help them live healthier?
So that's a big onion to peel. So, I mean, my thing is, I'm not gonna know. I'm gonna cook it now. I just think we as people, we're not as organized as we should be. We have such resources available to us. The political might, if used correctly, we just don't do it. But I think it's always like a divide and conquer type of strategy. I think it's maybe on purpose, but we don't do things as a block. This would never happen in the Mormon community, right? It wouldn't happen. And so my concern for the future is, what's the next pandemic going to look like? It's coming. I'm not going to prevent it, but I think this has told us that we're ill prepared to deal with it. And so I mean, people may be optimistic. I'm a little, I don't say pessimistic, realistic. I just, I just don't see where the will from the grassroots and also at the top is going to come from, like, making hard choices. We just don't want to do that. And so sometimes when you're thinking about the common good, sometimes hard choices have to be made, but I think it's not going to be there because there's so much, one, disunity, and then two, I don't think the political powers and the powers that be really have a lot of our interests, good interests and good intentions at heart. So I'm a little bit more pessimistic than everybody else here is, so I apologize.
Not that much more pessimistic. No, listen, we're not in great shape. It took a war, World War I in the first example, to eventually get us to say, wait a minute, maybe we ought to do something about this. And by the way, they didn't because they were fighting a war. The reason we got COVID, many people will tell you, is because of how our planet has been responding with climate change. This is, perhaps what is part of a climate crisis. And as the climate continues to change, as geographies continue to become more accessible to people, and as migration patterns change and yada yada yada, we get more of this. The reason I can say with some level of certainty that there's another one coming most likely is just because this is what happens with climate change. The Black community is terrible on understanding, appreciating, and advocating for solutions to climate change, right? So part of this is we need to make sure that we build broader structures of supports and kind of community where all stakeholders can come together, where we can have the trusted climate activists along with the health activists, along with the education activists, along with the criminal justice activists, and yada yada, and we can all sit back and say we're all here for the same community. So we can each put on a different trusted hat, wear that trusted hat in a conversation, and when the next thing comes, we don't necessarily ask the same person for feedback. We ask the trusted person who speaks on that issue. Does that make sense? Instead of always asking Big Mama on what to do with this and what to do with this, like, we know, when I say if you don't have a doctor, get a doctor, we have the doctors, and we have the climate folks, and we have the educators, we have the principal, we have the pastor, we have the priest, we have the imam, et cetera, et cetera, et cetera. We need to all ensure that we build a collaborative community where we have stakeholders with expertise, and then we trust them.
And that led right into the plug in terms of, the Society of Black Physicians, who do not represent enough of the physician workforce. And, I guess the root solution to any type of health challenge, you've got to have your baseline health together. We've got to already be in place to do what we do. Even if it's like you get cancer, we can't wait until you can't wait until you get cancer to grow a doctor. Do you know how long it took her to do that? Like, it's just not going to work like that. You'll be dead a couple generations before you get a cure. You know what I mean? So that is one of the reasons why we exist, to really help to educate the community, not only on general health matters, but for you to understand how important it is that you have people who represent you and understand whatever Big Mama might have told you, and understand that, what things might have been valuable in that, what things might have been misguided in that, and to be invested in building up that physician workforce. We saw the babies here earlier, learning to plant something. I think that's great because that's the root of us having good health. But then we need to take those same babies. You can't just roll over in bed one day and be like, I want to be a doctor. It don't work like that. They have to be prepared. So education becomes important. Mentorship becomes important. Even the finances of how you can fund someone through college and medical school, and then they finish medical school, and guess what? There's only a certain number of residency spots. Xavier just opened up a medical school, but guess what? No more residency spots. You can't be a licensed doctor in the United States if you don't complete a residency in the United States. So then the political, because that's like a political thing.